Hello, guys. My name's Abdallah. Today, Hunter, Peter, Brittany, and Michael and I will be talking about Zendura FLX for clear aligners.
Zendura currently manufactures two products that are used for the fabrication of clear aligners and retainers. Both Zendura A, which is the older generation, and Zendura FLX, which is the newer generation, use polyurethane polymers. In the case of Zendura A, it's a monolayer of polyurethane. And for Zendura FLX, there's a unique trilaminar structure containing an inner core with increased flexibility and elasticity while still retaining its toughness. The polyurethane polymer is made of ethane monomers. It can be both a thermoset or a thermoplastic, depending on its intended application and on the presence or absence of cross-linking structures. This is similar to PMMA, which can be a thermoplastic in its PMMA acrylate form, or a thermoset in its cross-linked PMMA form. Its thermoplastic form is used by Zendura for its durability, tensile strength, flexibility, and of course, its ability to be molded with the application of heat and reforming of bonds when cooled. This is, of course, what you want for an application such as aligner and retainer fabrication.
As Hunter mentioned, Zendura A and Zendura FLX are quite different. This table summarizes the property of each product. And you can clearly see that the newer Zendura FLX improved in almost every category except for the durability, and this may be due to the added elastic layer. Before going into the comparison with the classic products, I just wanted to define the generation categories of the clear aligners. The inception of the idea of clear aligners dates back to early 20th century, and in the early 1990s, the first commercial clear aligners emerged into the market. The first generation were single-layered plastic made with single material, and it solely relied on the shape of the plastic to do its job. The second generation utilizes multi-layered plastic with different materials, and along with the shape of the plastic, it uses physical characteristics to apply orthodontic forces. The third generation that are being studied nowadays utilizes auxiliary elements such as clear brackets and elastic bands, with some experiments trying to incorporate bioactive materials into the aligners. The Zendura FLX is considered as the second generation of the clear aligners. And so as Hunter and I mentioned before, the Zendura FLX has a unique tri-layer structure. The elastomeric middle layer of this structure provides what's called a rebound effect, providing additional elasticity to the Zendura aligner. The very left picture represents the materials used for the first generation aligners, which are rigid and prone to deformation or even failure in high load. On the other hand, the elastic property of the Zendura FLX allows the material to undergo elastic deformation. Moreover, it allows the aligners to rebound the lateral and rotational forces.
As Peter just mentioned, due to the formation of three layers with the middle elastomeric layer, Zendura does claim to have up to 150% better recovery in mechanical deformation than their competing materials over a 7 to 10 day wear period. And this elastomeric layer has been shows viscoelastic properties, which means as a load is taken off, it is advertised to be able to regain its original shape. And it was specifically engineered to be able to handle forces applied in every direction and demonstrate abilities of resilience and this rebound effect. So this includes from lateral forces to combat grinding and bruxation of patients to even rotational forces. However, it should be noted that due to load cycling, it is inevitable that eventually deformity of aligners will occur and wear out. But if this middle layer does exhibit such elastic properties, it can be helpful in terms of comfort and flexibility in comparison to other aligners and could therefore be good for the patients. The other effect is that they do have over 98% polyurethane resin in composition, which is able to provide not only high strength and ductility properties, but it also does boast clarity of material, which is for aesthetic purposes. This polyurethane resin has both thermosetting or thermoplastic. However, for the purpose of this use, the company does recommend using it for thermoplastic settings. And polyurethane has also been tested many times for biocompatibility, and it is commonly used for medical prosthetics, and it has been tested in vitro and in vivo. In vitro using various cell culture, so it is known to be safe and therefore good for patients to be using.
So in 2020, the Dentistry Journal published an article comparing 3 different thermoplastics used for aligner therapy. This article conducted in vitro tests determining mechanical properties from 2 competitors of Zendura, Duran and Biolon. To ensure proper testing conditions, each thermoplastic was thermoformed using the same mold. The image up here shows how they were shaped. Then each thermoplastic was subject to a different testing parameter. The thermoplastic was tested as supplied, after thermoforming, and after storage in artificial saliva. After initial parameters were applied, tensile strength tests were done using the universal testing machine shown below. Each condition created its unique stress strain curve, which was used for analysis. Mechanical properties of elastic modulus, yield stress, and resistance were determined for each one of the thermoplastic listed. As mentioned before, the 3 thermoplastics were compared under tensile stress in 3 different conditions. T is when the thermoplastic has been thermoformed, AS is as supplied, and SAS is stored under artificial saliva. A good aligner material should display high resistance as it continually undergoes loading throughout wear. If we look at the area under the curve up to the yield point to determine resilience, we can see that Zendura thermoplastics after thermoforming and storage in saliva displays higher resistance than the competitors. Furthermore, if we look at the yield point for each, although Biolon has the highest yield point, Zendura is close behind, making for an ideal thermoplastic choice. Overall, the results from this in vitro study show that Zendura's mechanical properties are sufficient in providing ideal aligners for therapy.
For patients that might need general dentistry or orthodontic treatment, Zendura stands out as a recommended choice for aligners, showcasing its superior performance compared to its competitors. Through multiple examinations that evaluated their strength, flexibility, yield stress, it all indicates that Zendura exhibits the favorable characteristics for enduring oral stress in the mouth, as well as comfort for the patient. As Peter had highlighted earlier, Zendura FLX prioritizes the well-being of patients. And through Michael's graphs, he mentioned the strength advantages in several tests of the new FLX variant. The enhancements from the previous aligners constantly result in a prolonged effectiveness and improved outcomes through the years. Zendura was developed back in 1999 for trying to keep teeth in their orientation post-orthodontic treatment. Through recent years, scientists have been able to make improvements and created their new project called Zendura A and their most recent product, Zendura FLX. The recent improvements of having 3 layers of polymers compared to unusual polymers makes a difference while handling the stress in the oral cavity. With this in mind, it allows the material to withstand way longer in the mouth and more comfortable for patients. Thank you guys for listening to our topic about Zendura FLX and the benefits it can provide to patients in today's world compared to their competitors. And on our next slide, you will see the references. Thank you guys for tuning in with us.